Good afternoon. I'm Jeff Birdwell, Director of Huntsville, Madison County Emergency Management Agency. It is Wednesday, August 26th. On behalf of Mayor Tommy Battle, Mayor Paul Finley, Commission Chairman Dale Strong, Huntsville Area Government Emergency Response Agencies, we bring you this daily briefing on our community response to COVID-19. Our speakers today will be David Spillers from Huntsville Hospital and Mayor Tommy Battle from the City of Huntsville. You will note that we are sitting at least 6 feet apart according to CDC guidelines, as well as our own best practices to separate and sanitize. At this point, I'll go over the current numbers. In the state of Alabama, there are 112,126 confirmed cases of COVID-19. In Madison County, there are 6,008 confirmed cases, resulting in 41 confirmed deaths in Madison County. As always, we continue to monitor this and respond accordingly. At this point, we'll go to our first speaker, Mr. David Spillers from Huntsville Hospital.
Good afternoon. The information I have to share is encouraging. Our trends are all going in the right direction. As of this morning at 10 o'clock system-wide, we had 135 COVID positive patients that were hospitalized in our hospitals across North Alabama. 36 of those were in the ICU. That's down 15 from the last time I reported. I think it was a week ago today. 21 of those patients are on ventilators. That's down 14 from a week ago. System-wide numbers a week ago were 34 more than the 135 I just reported. So all the trend lines look good. Madison County is also down. Number of inpatients in Madison County today is 71. That's down 21 from the previous week. 64 of those are at Huntsville, Maine, 7 are at Madison Hospital. We've only got 14 patients in the ICU. That's down 10 from last week. 11 of those 14 are on ventilators. That's down 9 from last week. Crestwood has 11 patients this morning. That are in the hospital. 2 of those are in the ICU, one on a vent. In the region, Decatur, they have 21 inpatients. That's up 3 from a week ago. Marshall has 12, down 3 from a week ago. Helen Keller has 14. That's down 12 from a week ago. So they've seen a significant reduction there. Athens has 11. That's +1. Highlands has 4. That's down 2. So throughout the region, the numbers continue to come down. Very positive news. I've said earlier, say it again, a very manageable number for our systems, about 60 patients, 30 in the region, 30 in Madison County. We hope the numbers, we would love to have 0. I don't anticipate having 0 till the vaccine is available and we don't have to worry about this again. But if we could keep that number system-wide below 60, then it would allow us to continue services for other patients that need health care. Statewide, the numbers also continue to trend in a positive direction, slowly, but moving in a positive direction. Yesterday, across the state, there were 1,122 patients hospitalized in hospitals across the state. That's down 145 from a week ago. So it's a good trend down. If you look at the hospitals with the large number of patients, Huntsville Hospital, as of yesterday, had 75. UAB had 67. Mobile Infirmary, 56. DCH in Tuscaloosa had 55, and East Alabama and Opelika had 52. Testing statewide or locally continues to go down. We ran our flu and fever clinic on Monday. We had probably the smallest, I think we had about 130 patients show up at our flu and fever clinic. That's unusually low for a Monday. So the number of people seeking tests continues to go down. We're only running 2 drive-through clinics this week. Had one yesterday, we'll have another one tomorrow. We can do up to 300 tests today at those drive-through clinics, and the one yesterday was not full. So always a good sign when people are not seeking testing in a community. Positivity rates of people who test has fallen down and kind of leveled off at about 6%. Again, most of the people who are seeking tests have some reason to believe they may have COVID, so About 6% of those are testing positive. The good news is a large portion of people who think they have COVID and getting tested don't have COVID. So that's a positive sign. Statewide, the percent of people testing positive a little bit higher than that, probably closer to 7%, maybe a little more. One of the numbers that I saw this morning that I thought was particularly interesting is the number of tests being done in our state now. We're doing around 100,000 tests a week statewide. Back in early May, that number was a little less than 25,000 a week, so substantially more testing capability statewide. I think you'll continue to see that the ability to do tests ramp up across the state, and that will certainly help us if there's another wave or another increase in patients in the near future or before we get this pandemic taken care of. Concerns, a little concerned about what we see in the communities that have large universities. You all saw the pictures. Hard to imagine that that's not going to lead to an increase in positive cases in those communities. Two of those communities I mentioned earlier already have a lot of patients. In Tuscaloosa and Opelika, there's a large number of inpatients there. The hope would be that the young population would not convert to inpatients. Young people tend to do well with this. They tend to get sick and get over it. So if they don't spread it to high-risk populations and adults, then it may not lead to a substantial spike in the hospitalizations in Tuscaloosa and Opelika. At least that would be the hope. We'll know that probably in 2 to 3 weeks. That's about the time it takes for this to develop and mature to the point that people need hospitalization. So we'll be keeping an eye on that. Other concern we had locally and around the state, I'm a football fan. Looking at sports and looking at all the people in the stands at the football games, a little concerned that people weren't socially separating at the football games. And we need to be thoughtful. Perfectly okay with people playing football and people going to games, but we still need to do some separation when we're at football games. And ideally, people would wear a mask, but if you don't, at least separate so that you're not bunched up together. Otherwise, again, that can lead to a spike in the people who have COVID. And anytime you increase the number of people who have COVID, you potentially increase the number of people in the hospital, which is our biggest worry. Our staffing situation right now is good. We're down to 77 people across the system that are out due to COVID or COVID-related issues with family members or others. That's down 20 from when I reported a week ago. That's down from a high of probably 250, 260 at one time, so that's come down substantially. We hope that number will continue to go down. Take just a second and thank all the healthcare providers and the people who work in hospitals and physician offices and others who are taking care of the COVID population and everybody else. I'm reminded when I walk through the hallways and talk to people, healthcare workers are dealing with the same stresses that everybody else are dealing with during the pandemic. I mean, they're worried about the economy. They may have a loved one out of work. They're having to worry about someone doing virtual school and how do they teach students while they're working. All the same issues everybody else is dealing with, but they're coming in every day and they're taking outstanding care of our patients. And I really appreciate all of them doing that. And that's everyone from the nurses and caregivers to the people who are taking care of making sure the hospitals are clean and sanitized. And I'm very comfortable, I'll say again, very comfortable that if you need health care, come to a hospital. There's a very low probability you would get COVID coming to a hospital. We're perfectly capable of taking care of patients that need health care, and many people need health care non-COVID related. Don't delay care, come to the hospital. But tremendous appreciation and respect for our healthcare workers. Many of you know we lost one of our team members in Marshall last week to COVID. I worked in the emergency department at Marshall South. Longtime employee, very well loved, well-respected employee. So really hits home when one of your team members and caregivers, a tragedy like that happens. And it reminds all of us that everybody can get this. Everybody can have a bad outcome from this. Luckily, most people don't. But that's why we have to be vigilant, because it's still a dangerous disease, and it can still have a bad outcome. So that's all I have for this morning. Be glad to take any questions at the appropriate time. Thank you.
Thank you, Mr. Spillers. And now we'll go to Mayor Tommy Battle from the city of Huntsville.
We'd like to kick off by saying thank you to the Huntsville Hospital employees, the Crestwood Hospital employees, all the healthcare industry people out there who have helped get us through this pandemic. We are on the right side of the pandemic right now. The numbers that we are looking at are very good. We had an increase of 82 cases over the last 2 days. That's an average of 41 a day. Much better than where we have been over the last month and a half. We still have to remind everybody, we still have to stay sanitized, stay separated, keep face masks on. We had a gathering last night, and we stressed that we needed to stay separated and we need to stay sanitized and keep our face masks on. Everybody did very well. Maybe except for my grandson, who's 5 years old. We had to work on him a little bit. But as we look through this, our numbers are decreasing. Our quarantine numbers have dropped from 810 down to 682 because of the flux in today. They're now at 712, but we've dropped the number of quarantine people. That's the number of people that are being quarantined because of contact with COVID-19. If we can keep this going that way, I think that we'll find ourselves in a very good place. To the people of Madison County, thank you for supporting us. Thank you for making sure that you've stayed masked. Thank you for making sure that you've stayed separated. You have been the ones who have really made the difference, and if we keep on doing what we've been doing, we'll continue to be a success. So thank you.
Thank you, Mayor Battle, and thank you for watching today. We'll be back here again on Monday, August 31st, for another daily briefing at noon. Until then, critical updates will be posted to the City of Huntsville's COVID-19 webpage, as well as the websites of our other partners here today. Until then, stay safe, stay separate, and remember to sanitize. At this point, we'll take questions. As you come to the mic, please identify yourself and who you're affiliated with, and we'll allow one question and a follow-up.
Good morning, gentlemen. Sophia Borelli from Way 31. In college towns, and Dr. Spillers, even you mentioned it, we saw social distancing and a lack of social distancing and enforcement. It's forced Tuscaloosa to shut down bars for 2 weeks. Has Huntsville made or considered making any changes in terms of enforcement for bars and restaurants?
I'll kick that one off. We have, we early on looked at what to do with bars and restaurants. The governor came out with no alcohol sales past 11 o'clock. I think that's been part of our success. The masking ordinance is part of our success. The no alcohol sales coming out of the ABC after 11 o'clock has been part of our success. I think we are on the right track at this time. Tuscaloosa had a little bit more of a problem than we had, especially with the college students coming back to campus. I think that their steps were probably very appropriate steps, just because of the intensity that they were seeing of people getting together and the probability of having spiked cases in the next 10 to 15 days.
And then my follow-up to that is this something that officers are going to start looking for if there are complaints, or if the status quo complaints are made, and why?
Thus far, from what we've seen, our restaurants and lounges have taken this very seriously. They understand this is a licensing issue. ABC holds their license. If they don't comply with it, ABC will pull their license. And every one of them that we have talked to or had conversation with have followed through very well on this.
Brian Lawson, WH&T. For Mr. Spillers, and maybe for Mayor Battle as well, we've seen, as we just talked about, issues related to college cases. UAH is on that list of cases that have cropped up, and there's some data about isolation capacity starting to be occupied. I wondered to what extent either the hospitals or the city are conferring with UAH about providing assistance to make sure this small problem doesn't become a big problem.
We have not been in discussions with UAH about how they're managing the student population. It wouldn't be our place to help quarantine non-hospitalized patients.
I guess I meant more about space but also testing.
Testing, the state schools have all got a testing agreement with UAB. That was part of the funds that the governor provided to do their testing. So they have access to the testing they need, and then I think it's up to each school to manage how they quarantine the patients and what they do. I do think, though, I mean, if clearly it could get out of hand very easily at a college. If you get enough of the students that have COVID, they'll have to do as they've done in North Carolina and go back to virtual schools. The University of North Carolina system basically shut down because the number of students with COVID got to the point that they can't isolate them on campus. So what do? You go to virtual and you get everybody to go back home. So very familiar with what happened there because I was talking to one of the leaders at the UNC system earlier this week. So I think if the students want to stay in school, they need to be careful. Otherwise, Alabama schools will have to do what other states are doing, and that's go to virtual college classes, and then there won't be a lot of people in the bars because there won't be a lot of people around to go to the bars.
And I had conversations with the chancellor of the University of Alabama system, as many as 3 months ago. And they had what they would call a Blue Star team of professionals working through how they were going to come back to campus. Everything I've heard about on campus, things are working very well. In fact, they're giving citations if they're not staying separated enough. They're making sure everybody's wearing masks and everything. It's the off-campus activities that are giving us the communities problems. And off-campus is things like the Strip when everybody goes down there and it's not within the campus boundaries. There have been some problems there. I think that's why the mayor of Tuscaloosa took the steps he had to do to close the bars. More as a warning that we've got to maintain this, or else we're going to have some tremendous spikes coming out of it, especially that area, the Auburn area. Some of the commuter schools may not be as affected as much, but the schools where students go to stay and study, those are the ones that have been affected so far.
Thank you. For Mayor Battle, I wonder, we're 5 months plus into this situation. I wonder, given the events of yesterday and going forward, do you view leadership differently now, having been in the midst of this for some time? Do you think differently about what your role is or how best to serve in that role, just given you've had to be a person reassuring folks and reaching out and also messaging in a different way than maybe previously?
Yeah, it's been a different day. We went through a campaign, and in the campaign, you didn't have the 40 neighborhood meetings that you would have in a normal campaign. You had Zoom meetings. You would get together on blogs, and you had debates via Zoom meetings, and it was very, very different. But it's a different way of messaging to people nowadays. These masks that we're wearing right now, I think these masks are going to become something that we will continue to wear in the near future until we come up with some kind of vaccine that everybody feels very, very comfortable with. When we first let up some and had the masks and opened some of the restaurants and had them open till 9, 10 o'clock at night, we thought that we would see a big surge of people going there, and quite frankly, we have not. People are still doing takeouts. People are still doing pickup care with or pickup meals with the restaurants. We're not seeing as much interaction between people because, quite frankly, they're scared. They want to make sure that they don't get that COVID. And I think our job each day is to give them the information about where we are today, where we could be tomorrow, and where we've been in the past. And if we can translate that to them and make sure that people understand that, we can keep our community safe. And it all gets down to the safety of a community. That's why Mr. Spillers in Huntsville Hospital does everything they can. We have seen the value of having a publicly owned hospital here that can put money back into making sure that the right things happen in this community. The fever and flu clinic, the drive-through testing, taking testing out to some of the lower income areas has all been something that has been able to be done because that board doesn't have to worry about the profit line quarter to quarter. They have to worry about how that they're serving a community.
Thank you.
Brian, one thing I'd add to that, the question was for the mayor, but the mayor started these news conferences when this was early on in the process. And one thing that was reinforced to me and has been throughout this process is the value of communication. I think our community, by and large, has done a fabulous job communicating issues, good, bad, total transparency, giving people numbers, not trying to hide anything. We've not dodged any questions. We all get together as a group. We communicate daily. And I think that's a lesson learned for any other community that has to deal with something like this, but also a lesson learned in general is communicate openly, be transparent, share good and bad information, and that's how you build credibility with the community. That's how you get through issues like this. That's how you get everybody on board. And that's again, I totally respect the mayor for starting this and appreciate the fact that he started this press conference, and we've been doing it on a regular basis, as well as the EMA calls that happen 2 and 3 times a week, and early on 5 days a week, 7 days a week, I guess, 6 days a week. We always took Sunday off, but there's been tremendous communication with a lot of people internally and externally throughout this process, and I think that's benefited all of us.
Good deal. Thank you.
At this point, we'll conclude the press conference. Thank you for coming.